Papua New Guinea is facing the most significant HIV epidemic in the Pacific. Current projections show that more than 60,000 people are living with HIV in the country. Prevalence is around 1%, higher than any other country in the region. For the last 20 years, the Collaboration for Health project in PNG has been tackling this challenge head-on and has made significant inroads, but there is still much work to be done.
So this Mary, mother of Mercy Care and Counselling Centre, used to be the HIV clinic when I first came here. In those days we had to see patients more regularly because the drugs were more toxic. Now the clinic has 2,000 patients. The pill packages are much better. They can supply 90 days at a time, and most of the time most patients will get 6 months of medication, which is completely different from how it used to be. What's happened now is that this is one of our major training centres, and when we run prescriber courses up here, we use both buildings to teach participants how to care for patients with HIV.
The project began in 2003, a collaboration between ASHM, the National Association for People Living with HIV Australia, Caritas, IGAT Hope, the PNG National Department of Health, and the Catholic Church Health Services of PNG. It started with a focus on building the capacity of the health workforce for HIV diagnosis, care and treatment. Mentoring visits were conducted across 8 provinces, training healthcare workers in HIV, STIs and related issues. During these early years, CHPNG was supporting up to a third of people with HIV on treatment in PNG. And from there, momentum grew. Between 2008 and 2013, workshops were run to train local doctors, and 7 rural laboratories were opened across 4 provinces. In 2014 and 2015, the number of mentors and sites expanded, and comprehensive training packages centred on ART prescribing and STI management were delivered. Between 2016 and 2018, training continued to expand, with ASHM clinical mentors connected to health sites and health workers. By 2019 to 2021, 14 clinical mentors, local health workers experienced in HIV management, were trained to support new HIV prescribers.
Mr. Jesse Bluno and Sister Maria Koke are trained clinical master mentors. The aim of their training was to mentor and coach, guide other trained HIV workers who were trained prescribers on managing ART, doing patient follow-ups, drug adherence, managing ART stock record and accurately reporting using the new HIV and STI reports form.
As the COVID-19 pandemic began, the project continued to provide remote mentoring support to healthcare workers.
The COVID-19 WhatsApp group has supported me in my work in terms of correcting misinformations. I updated us the number of vaccinations, the number of people infected, and the general population. Also, it helps the staffs and people living with HIV getting vaccinated. And furthermore, it enriched our knowledge about COVID-19.
To date, more than 25 clinical mentors have been trained across Papua New Guinea. More than 5,000 patients are now seen in the Western Highlands and Southern Highlands provinces, provided with support through our clinics, up from just 34 in 2007.
I think that the CHPNG program has had a significant and very effective impact in sexual health test and HIV services in this country. And I think this program should continue.
CHPNG can be justly proud of the contribution it's made. When I first went up to the Highlands, we had 4 people on treatment. Now we literally have thousands. We have training programs for prescribers, we have training programs for mentors. None of this is possible without the continuing generosity of CHPNG on the ground.
NAPWA helped set up the Collaboration for Health in Papua New Guinea over 20 years ago. The first thing we did was to meet the people living with HIV in Port Moresby and help them establish the organisation called I Gat Hope, which is Tokpisin for I have, we have, there is hope. 20 years on, we know that the peer counsellors in clinical settings are now making a great contribution to managing the ongoing HIV epidemic in Papua New Guinea, and thereby reducing stigma and discrimination and assisting people to adhere to their antiretroviral therapies.
Stigma and discrimination remains a serious problem for HIV-positive people in PNG, and this program has filled a gap of giving information and enhance the knowledge of people who are diagnosed in PNG. The program really supported a few workers to increase their knowledge and impact this knowledge to their peers in terms of helping them to stay adherent to their drug and to live a normal life.
While significant progress has been made over the past 20 years of the project, there is still work left to do. As the HIV epidemic continues in Papua New Guinea, it is as important as ever to continue to train healthcare workers and to provide the support they need to ensure prevention, testing, treatment and care for people living with HIV, their families, their communities and their country. CHPNG and all its achievements have been made possible by a collaboration between pharmaceutical companies established 20 years ago. For their support from 2003 until the present day, thank you to Janssen, Gilead and Vive Healthcare. Find out more about the project and how you can contribute at asham.org.au/CHPNG.